My name is Megan Carver. Today is January 20th, 2025. This is the room and the ceiling, the floor, my supplies. For the skin, I'm looking at the head and face, neck, anterior, posterior, chest, and abdomen. For color, temperature, moisture, texture, edema, turgor, bruising, scars, lesions, and nevi. I'm inspecting his head first. He is normocephalic, symmetric, and midline. Inspect the scalp. Hair distribution is even, color is brown, texture is soft, no lesions, masses, tenderness, depressions, or infestation. Palpate the carotid-temporal arteries for tenderness. The preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular lymph nodes. For TMJ, open and close your jaw, move it side to side. Cranial nerve 5 is the trigeminal nerve. Clench your jaw. I feel over the masseter here. Now, close your eyes and tell me where I'm touching your face.
Forehead, nose, left cheek, right cheek, chin.
Cranial nerve 7 is the facial nerve. You can open your eyes, smile, frown, raise your eyebrows, puff your cheeks, pucker your lips. Cranial nerve 5 and 7 are intact. For the ears, palpating the pinna and the tragus for masses and tenderness. I'm going to inspect the auditory canal. The left is patent tympanic membrane, pearly gray, positive light reflex at 7 o'clock. The right is patent tympanic membrane, pearly gray, positive light reflex at 5 o'clock. Cranial nerve 8 is the auditory nerve. I'm going to do 3 hearing tests. Cover one ear. Tell me what you hear.
1, 2, 3.
In the other ear.
1, 2, 3.
The Weber test for lateralization. Tell me if you hear this vibration evenly across your head.
Yes.
And tell me when you stop hearing it now.
I've stopped.
And do you still hear it?
Yes.
And on this side, tell me when it stops.
It stopped.
And do you still hear it?
Yes.
Air conduction is greater than bone conduction. For the eyes, I'm inspecting the brows, lashes, palpebral fissures. The sclera are white, conjunctiva pink, no lesions or discharge. Cranial nerve 2 is the optic nerve. I test gross visual acuity with the Snellen chart. Cover one eye and read me the lowest line.
LTFPH.
And the other eye.
LTFPH.
And now with both eyes.
LTFPH.
Okay, for peripheral vision, tell me when you start seeing my fingers.
I can see them.
And pick a spot on the wall. Follow my finger in. Good. Cranial nerve 3 is oculomotor. I use my pen line to check pupillary response. Pupils are equal round, reactive to light, and accommodation. Cranial nerve 3, 4, and 6 are the oculomotor, abducens, and trochlear, and we test that by following my finger through the 6 visual fields. Okay, and red light reflex. Okay. Disc margins are sharp, no AV nicking or woolly bodies. For the nose, I inspect first. His nose is midline and straight. I'm going to check cranial nerve 1, the olfactory nerve, and nasal patency at the same time. So close your eyes, close one nostril. Tell me what this smells like.
Alcohol.
And the other nostril, what does that smell like?
Perfume.
Okay. And palpate the frontal and maxillary sinuses. For the neck, palpate the trachea at its midline, the thyroid. I'm going to move it to one side and swallow. And the other side, swallow. Carotid arteries are strong. Palpate them. And listen with the bell of my stethoscope to the carotids for bruise. Okay. For the mouth and throat, I'm inspecting the lips, teeth, gums, buccal mucosa, palate, floor of the mouth, salivary ducts, posterior pharynx, and tonsils, which are absent. Cranial nerve 9 and 10 are the glossopharyngeal and the vagus. So say ah.
Ah.
One more time.
Ah.
Soft palate and uvula rise symmetrically with phonation. Cranial nerve 12 is hypoglossal. Stick out your tongue, up and down, and side to side. Tongue is midline without fasciculations. Now for the posterior chest, you can turn around on the stool. I'm looking for signs and symptoms of respiratory distress like use of accessory muscles, tripod position, nasal flaring, retractions, tachypnea, and cyanosis. I'm looking for obvious deformities and symmetry. For symmetrical chest expansion, take a deep breath. Symmetrical tactile firmness, say 99 when I touch your back.
99, 99, 99, 99.
Okay, I'm going to percuss over the intercostal spaces. And auscultate over the intercostal spaces. Up top, above the scapula. Including the right middle lobe. I'm auscultating for egophony. Say the letter E.
E, 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 E.
And 99.
99, 99, 99, 99, 99, 99.
Now whisper pectoriloquy. So whisper 1, 2, 3 when I touch your back.
1, 2, 3.
Okay. For anterior chest, you can turn around. I'm looking for obvious deformities again and symmetry. Now for symmetrical chest expansion from the front, take a deep breath. And tactile firmness 99. Say the number 99.
99, 99, 99.
Okay. And auscultate. Okay, for the heart, I'm auscultating with the bell and the diaphragm. All 5 cardiac auscultation points. So first is aortic, and pulmonic, Erb's point, tricuspid, and mitral. Now with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. I'm gonna locate the point of maximum impulse. And now auscultate the apical pulse for a minute. Rate is 70, rhythm is regular. Now you can lay down on the couch. With him at 30 to 45 degrees, I'm looking for jugular venous distension. And then also heaves and lifts. I'm palpating for thrills over each auscultation point. So the aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to auscultate each point with him supine. With the diaphragm first. And now with the bell. abdomen. I'm looking at symmetry and contour. And I'm gonna auscultate with the bell and my stethoscope for bruits over the aorta, renal arteries, iliac arteries, and femoral arteries. Now I'm gonna listen with the diaphragm for vowel sounds for 5 minutes. And percuss each quadrant for tympany dullness and flatness. I hear tympany, and I palpate for masses and tenderness. Palpate the liver. I feel the border, and the spleen is non-palpable. Now you can get up on the stool, face the back wall. Next, I'm going to percuss CVA tenderness. Does that hurt?
No. No.
Okay, you can turn back around. Close enough. For musculoskeletal, I'm inspecting the joints of the hands, wrists, elbows, and shoulders for redness, swelling, deformity, tenderness, nodules, crepitus, and symmetry. Capillary refill is less than 3 seconds. Radial pulses are strong. Range of motion of the fingers is flexion, extension, hyperextension, abduction, adduction. Thumb opposition. Wrist is flexion, extension, hyperextension, ulnar deviation, radial deviation, rotation. Elbow is flexion, extension, extension, hyperextension. Shoulder is flexion, extension, hyperextension, abduction, abduction, adduction, circumduction, internal rotation, external rotation. Squeeze my fingers here. Grip strength is 5 out of 5. Bicep, tricep strength. Push out against my hands, and I'll pull in. It's 5 out of 5. Shoulders is pull in against my hands, and push out. Shoulder girdle strength is 5 out of 5. Show your shoulders against my hands. It's cranial nerve 11. The accessory nerve is intact. Shoulder girdle strength is 5 out of 5. For stereognosis and graphesthesia, close your eyes. I'm going to put something in your hand. You tell me what it is.
Safety pin.
And
Clothespin.
okay. I'm going to draw something on your hand. You tell me what it is.
Letter C. Number 4.
Okay. For cerebellar coordination, we have serial finger opposition, flip flop, and touch your nose and touch my finger a few times. Okay. For light touch sensation, tell me if you feel something sharp or soft.
Sharp. Soft. Soft. Sharp.
Okay. I'm assessing the upper and lower extremities for color, warmth, and skin integrity, but also edema and vibratory sensation. I'm going to place my tuning fork over the proximal ulnar prominence of the wrist. Do you feel that?
Yes.
And here.
Yes.
And the medial malleolus of the ankle.
Yes. Yes.
Okay. For deep tendon reflexes, we have brachioradialis, bicep, tricep, patella, Achilles, and Babinski. I'm looking at the joints of the feet, ankles, knees, and hips For redness, swelling, deformity, tenderness, nodules, crepitus, and symmetry, capillary refill of the toes less than 3 seconds. Dorsalis pedis pulses are strong. Posterior tibial are strong. Range of motion in the toes, we have flexion, extension, hyperextension, abduction is apart, adductions together. For ankles, there's dorsiflex is pull up and plantar flex is down. Eversion, inversion, rotation. And now for ankle strength, you dorsiflex against my hands, plantar flex against my hands. For knees, that's 5 out of 5. For knee strength, push out is extension, pull in. Knee strength is 5 out of 5. For hip strength, it's pull in. And then push out against my hands. Hip strength is 5 out of 5. Now you can stand. Range of motion of the hip, flexion, extension, hyperextension, abduction, adduction, circumduction, internal rotation, and external rotation. And then on the other side is flexion, extension, hyperextension, abduction, adduction, circumduction, internal rotation, external rotation. And of the knee, flexion, extension, hyperextension, flexion, extension, hyperextension. And for the lumbar spine, bend over. I'm inspecting the expected curvatures, alignment, and tenderness. Also scoliosis. This is also flexion of the lumbar spine. Now stand up straight is extension and lean back. Hyperextension, lateral flexion, and rotation. And with the cervical spine, it's flexion, extension, hyperextension, lateral flexion, and rotation. Now, the Romberg test, you stand still, close your eyes. I don't see him swaying or losing his balance. Now walk toward the camera with your eyes open. Now walk back, tandem gait. Regular and tandem gait are steady. Now hop on one foot and hop on the other.